Risks and warning. 10 medications that may raise your risk of liver damage. This football-sized powerhouse helps keep you alive and healthy. As you move throughout your day, it works hard to detoxify your blood, help with digestion, and restore your energy levels. We can't live without it. Your liver also plays an important role in metabolizing medications, but some medications can directly damage this vital organ in what's known as drug-induced liver injury DILI. Here, we'll discuss 10 medications that could potentially harm your liver, what symptoms to look out for, and what you can do to prevent liver toxicity, hepatotoxicity. 1. Tylenol. Tylenol acetaminophen is a common over-the-counter OTC pain reliever and fever reducer. It's not toxic to the liver when it's taken occasionally and within recommended dosages. However, large doses and/or chronic use can cause liver damage. In fact, just one large dose of Tylenol can cause liver damage. This is called Tylenol overdose, which is a medical emergency requiring immediate attention. Tylenol can also cause liver damage if it's taken too frequently, especially over a prolonged period of time. This concern is more relevant among people who have a serious illness, alcohol use disorder, or pre-existing liver issues. You can lower the risk of liver problems related to Tylenol in the following ways. Don't take more than the maximum recommended amount 4 mg per day. Avoid drinking alcohol while taking Tylenol. 2. Antibiotics, like Augmentin. Augmentin amoxicillin clavulinate is a common antibiotic for respiratory, ear, and skin infections. It's the antibiotic that's most likely to cause liver injury though. It's not a very common side effect, overall. Liver injury typically occurs within a few days to 8 weeks after starting treatment with Augmentin. This is more likely to affect men, older adults, and people who have taken Augmentin multiple times in a row. Thankfully, the damage is usually reversible and does not cause lasting effects. 3. NSAIDs, like diclofenac. Nonsteroidal anti-inflammatory drugs NSAIDs are commonly taken for pain, inflammation, and fever. Some are available OTC, but others like oral diclofenac cataflam are available by prescription only. Diclofenac is one of the most likely NSAIDs to cause liver injury. In many cases, the damage is significant enough to cause elevated liver function tests ELFs, but not enough to cause symptoms. ELFs measure liver enzymes proteins, and increased numbers point to possible liver injury. These numbers are collected by your healthcare provider through blood tests. Serious liver damage is more rare, but the risk is higher for women and with larger doses and/or long-term use more than 4 weeks. Keep in mind, diclofenac also comes in topical forms, such as gels, creams, and patches. Keep in mind, diclofenac also comes in topical forms, such as gels, creams, and patches. 4. Amiodarin. Amiodarin pacharoni is a medication that's used to treat abnormal heart rhythms. Increases in ELFs happen in up to 50% of people taking amiodarin on a long-term basis, but this usually doesn't cause serious health problems. In some cases, though, amiodarin can cause more substantial liver injury. This is estimated to affect up to 1% of people taking the medication. The FDA issued a boxed warning, its most serious medication warning, about this risk. Liver injury related to amiodarin is more common in people who take the medication at higher doses and for long periods of time. Thankfully, this risk can be monitored. You'll likely have regular ELFs while taking amiodarin to make sure your treatment doesn't need to be adjusted. 5. Allopurinol. Allopurinol xyloprim is a medication that's used to prevent gout flares. Some people also take it to prevent certain kinds of kidney stones. And, more rarely, people with cancer take it to prevent a complication called tumor lysis syndrome. Allopurinol can cause minor, reversible increases in ELFs in up to 6% of people who take it. This usually does not lead to any long-term problems. Less often, allopurinol can cause liver problems as part of a broader condition called drug reaction with eosinophilia and systemic symptoms DRESS syndrome. DRESS syndrome is a reaction to medication that also causes fever, rash, and abnormal blood tests, among other symptoms. Allopurinol is also associated with severe skin reactions, such as Stevens-Johnson syndrome (SJS) and toxic epidermal necrolysis 10. And these conditions can also harm your liver. 6. Anti-seizure medications like phenytoin. Anti-seizure medications top many lists as potential causes of liver injury. Phenytoin dilantin is one of the most common causes of DILI and liver failure, but the occurrence of liver damage related to the medication is still pretty rare overall. It happens in less than 1 in 1,000 people taking phenytoin. Liver injury typically occurs 2 to 8 weeks after starting treatment with phenytoin. Almost all phenytoin hepatotoxicity cases happen as part of broader medication reactions that affect the whole body, such as anticonvulsant hypersensitivity syndrome (AS), DRESS, SJS, and 10. However, most cases of this type of liver injury resolve within 1 to 2 months of stopping treatment with phenytoin. Other anti-seizure medications that have been connected to liver problems are valproic acidepakine, carbamazepine tegretol, and lamotrigine lamictal. 7. Isoniazid. Isoniazid is an antibiotic that's effective at preventing and treating tuberculosis, but it's one of the top 10 most likely medications to cause DILI in multiple countries. Increased ELFs can affect up to 20% of people taking isoniazid, but only about 1% of people taking the medication experience actual liver injury. Most cases of isoniazid-related liver problems are mild and/or resolve within 1 week of stopping treatment with the medication. But isoniazid also has a boxed warning regarding the risk of severe liver inflammation. The risk of liver failure related to isoniazid is higher for women, Black people, and people with existing liver problems. It's also higher for older adults and people who drink alcohol daily. 8. Azathioprine. Azathioprine Imurin is a medication that intentionally suppresses the immune system. It's commonly taken after an organ transplant and for the treatment of an autoimmune condition. Azathioprine can cause a few types of liver injury. These range from mild, reversible increases in ELFs to long-term injuries that can develop 1 to 5 years after starting treatment with azathioprine. Liver toxicity related to azathioprine is most common in people who have received a transplant. Stopping treatment with azathioprine will usually resolve these issues, but your healthcare provider will likely routinely monitor your liver health while you're taking the medication. 9. Methotrexate. Methotrexate is most often used to treat cancer and autoimmune conditions, but it does have a boxed warning regarding the risk of liver toxicity. The degree of injury varies depending on the dose and length of treatment. High doses of methotrexate given through and for can cause large increases in ELFs, but since high doses aren't given routinely, liver enzymes tend to normalize quickly without symptoms. These doses are also usually administered in a controlled medical setting. Lower, daily doses of oral methotrexate aren't as likely to cause large ELF changes, though they may put people at risk for developing fatty liver disease or liver scarring. This is more common in people who already have risk factors for these conditions, such as excessive alcohol use or obesity. 10. Other cancer medications. Many cancer medications, including chemotherapy, targeted therapies, and hormonal agents, can cause liver issues. Pembrolizumab Keytruda and nivolumab Opdivo are 2 examples. These medications, called immune checkpoint inhibitors (ICIs), allow the immune system to better identify cancer cells, but sometimes they prompt the immune system to create an exaggerated response and attack healthy cells. This causes liver inflammation in up to 6% of people receiving treatment with ICIs. Can supplements cause liver damage? Bodybuilding supplements containing anabolic steroids, weight loss supplements containing green tea extract, certain vitamins, when taken long-term and at high doses, such as niacin, herbal products like ginseng and black cohosh, multi-ingredient nutritional products such as Hydroxycut, SlimQuick, and Herbalife. Keep in mind, not all supplements are linked to liver injury. Check with your healthcare team or pharmacist prior to taking a supplement to make sure it's appropriate for your situation. What are some symptoms of liver damage? abdominal pain or tenderness, dark urine, nausea or vomiting, unexplained weight loss, yellowing of the skin and eyes,